Hi, this is Dr. Esti Hess.
And I am Dr. Ann Kirsch.
And welcome to, once again, On and Off the Spectrum podcast. This is an interesting podcast because we reach out to families who are generally responding to life-altering diagnoses either for themselves or for their families. And we hope to create practical strategies for moving forward. One of the practical strategies that I think tonight we have two very special guests to address the concern. When you have a child with special needs, there's often something called sensory sensitivity, and that could be under or overreactivity to sensory experiences. One of the major milestones that can create sensory sensitivity or reaction to is going to the dentist. And so we have two wonderful clinicians, Dr. Michael Kleinman and Dr. Bernard Gross, who are going to be talking about their experiences in terms of how they treat the special needs community, all the way from a pediatric physician into the general lifespan. And I wanted to introduce you both and say welcome and thank you for coming on our program.
Yeah, pleasure.
Yeah, great to be here.
Yes, this is going to be very exciting for me because I was one of those kids who hated going to the dentist. And I was determined that when I had children, I would make it a different experience if I could. And I did, and the dentist did. So it has to do with the dentist.
So we're going to be talking about a bigger theme of phobia in terms of, how much for a neurotypical child that has to go to the dentist for the first or, 40th time, as it were, and even more so for those who are neurodiverse. But the first thing I thought we would do is get both of your stories and find out how did you choose dentistry to begin with, and then how did that veer off into working with a special needs population. So who would like to go first? Dr. Kleinman?
I can go first. So, I was born in South Africa, and I moved to the United States when I was 14 years old and finished high school here. And my whole life that I could ever remember from day one was I wanted to be a doctor. I'm not sure if it's because my parents wanted me to be a doctor or I wanted to be a doctor, but I always loved science and chemistry and bugs. And so that's kind of what set my path. When I went to UCLA, I was pre-med. I was a biology major, took a lot of real biology classes. I took plant physiology, I took a lot of ichthyology, and I was on the pre-med track. I had a very close friend who I met on my first day of high school in 10th grade, and he wanted to be a dentist. His grandmother was one of the first dentists in Israel. His mother was a physician. His father was a PhD food engineer. And I went with him to a clinic one day when I was about, I think my second or third year of college. It was a LA free dental clinic. And I was assisting a new graduate from Georgetown University Dental School, and he was doing oral surgery on extracting teeth, basically. And I was like, wow, I just got me very interested in dentistry. That's where my path changed from wanting to be a physician to wanting to be a dentist. And honestly, it was just that one experience that really it opened my eyes to what dentistry was about. So that's how I got started in the direction of being a dentist versus being a physician. When I applied to dental school, I sort of did a shotgun approach because I applied to a lot of dental schools. And one of the schools that I interviewed at was in Richmond, Virginia, where I ended up going, the Medical College of Virginia. And the Dean of Admissions, Dr. Marshall Brownstein, who actually ended up being a big mentor for me, was a pediatric dentist. And he also had family from South Africa, so he and I connected right away. And he always encouraged me to look into pediatrics as a specialty. When I was between my second and third year of dental school, I did an externship in an area called the Delmarva Peninsula, which is where Delaware, Maryland, and Virginia all come together. And I worked on migrant farm workers' children. for 3 weeks, with me and two friends and a dentist who was barely there. And that's really what piqued my interest. And from then on, I wanted to work with kids. And
that's
I did,
wonderful.
yeah.
That's just wonderful background. Thank you so much. And Dr. Michael?
My story is a little bit easier because Dr. Gross got it started for me. I also always wanted to be a doctor when I was a kid. I don't know why, but I did. And Dr. Gross is my uncle, and I used to go to him as the dentist. And over some time, he said, I think you would really like what I do. So I spent a summer in high school shadowing and interning and observing the office. And I said, wow, I love this. I just saw all these kids coming in day after day, just having a good time, and the staff had a good time. And it was such a positive, nice environment to be in. And I said, you know what, Uncle Bernard, I think you're right. I think this is going to work for me. So from then on, I just went straight through. I went into college and dental school, and I always, had a tendency to pediatrics after that. And I went with open mind to see what else in dentistry interested me. But every time I went to the pediatric clinic for a day, I came home. I said to my wife, I said, Tali, I'm just happy today. This just really worked for me. And I just decided to apply to pediatric residency. And now, fast forward many years later, we've been partners for over 10 years, and we get to work together, and our office is still positive and fun. And it's just, we get to really take these kids and start them off with such a good experience, and it hopefully will last them their lifetime. So that's what makes me excited about being a pediatric dentist.
I wish you had both been my dentist. Yeah, that would have worked. You had a good, Dr. Gross was a good influence. It's a wonderful story.
I like that. And I'm originally from Maryland, so I know that Delta area that you speak of. And so I'm appreciative of the work that you did with migrant children. And it is one thing to deal with little kiddos, and even something else to deal with children with special needs. So it's not for the faint of heart. I will tell you. I will tell you that over my years as a specialist in autism, I have worked with kids who are so highly defended. The phobias are so entrenched that either they have to be sedated to actually get any kind of dental work, or they refuse. I have a young woman who I'm working with now who she's now in her probably close to 30, and she has never gone to the dentist. It's just too frightening for her. At the same time, she's got a lot of pain and probably an impacted multiples of wisdom teeth and so forth. But and then it's like, here you go. So I actually asked a colleague to do me a favor and take a look at her, who was not a specialist, as the two of you are, in the context of the special needs community. And he tried to work with her very positively for a short amount of time, and then basically called me and said, no can do. This is out of my wheelhouse. This is not really an area where I can make a lot of headway, other than to say to her, she better brush her teeth. But these kids are so highly defended against what they perceive as oral invasion, as it were. How did it move, first off, from a general pediatric population to a special needs? And then also, how do you differentiate between, because I also know, Dr. Gross, for example, you treat children all the way through an adult population. And does that change in the context of your techniques and so forth? Because I think a lot of parents are desperate to try to do the right thing.
Sure.
Make sure that their kids are being seen by a dentist and get stymied over and over again.
For me, because I've been doing it so long, a lot of my kids that I would see at 1.5 or 2, 3 years old are now 30. So they've kind of grown up with me. I don't think that if I were to see a patient that was 30 that had, significant adult needs, it may be out of my wheelhouse too, in a way. I think one of the things that really help mostly is getting the patients in to see the dentist early on, because I think that you can begin a process of systematic desensitization. These children are I call it orally defensive. I'm not even sure if that's a real thing. But that's what I call it, because
it's a real thing.
They don't like the textures. They don't like the teeth brushing. I mean, it's not just me, it's the parents too. And I think if you can work with them from very early on, they may not like it, but they kind of get used to it. I mean, I have patients now that are, literally 33, 34 years old, that I've been seeing since they were infants. And they come in and we kind of surprisingly do quite well. It is a spectrum. So some kids will do really well over time and some just don't. It really is a spectrum. You don't really know how it'll end up or what you're going to get. But some of these patients, the first time I'll do an exam, I'll be in the waiting room. I'll just sit on the floor of the waiting room and take a hand mirror, barely touch them, look in their mouth, and they'll go home. They'll pick a toy and go. If they, and that's you kind of work from there. You really have to just. I don't have a set protocol. I just sort of take it as it comes, and do what you need to do. And if I count 4 teeth the first visit, then that's a success.
What you just said really touched me, because that's absolutely correct. You take it as it comes, and as a therapist, I remember having multiple first, second, third visits with one little girl who was learning to play a musical instrument. She would not come into my office, but what she would do, I said, where there's great acoustics, she knew about acoustics, is in the garage. And I'll show you where I park my car. And you can bring your trombone into the garage and you can play. Would that be okay? And she looked at me, she said, "You have a garage?" And I said, "Yes, it's got so many cars." That was all it took. Down to the garage. Her mother came to pick her up and overheard her playing in the garage. And when she came to pick her up, I brought her back out to the waiting room. The mother was in tears. She called me later and she said, "I don't know how you did that, but I couldn't believe she would play that instrument." I said, "At the last minute, bring it along. Maybe she'll want to see how shiny it is." So yes, wherever and whenever is my motto. I think that was just brilliant. And
sometimes it takes a long time,
It does.
But you're right about the acoustics. Being a bad trumpet player, I can appreciate that.
Dr. Kleinman, yourself, how did you veer into a practice that expanded, into a special needs population? And where I heard from Bernard is you meet the child where they're at, and that means, however long it takes to go from the waiting room into the exam room, so be it. Do you have any tips and strategies for parents, in addition to start young, if you can?
Well, just, to the point that Dr. Gross and Dr. Kirsch just said, pediatric dentistry, the reason why special needs is part of our training and part of what we do is because it's really the same thing. At the end of the day, it's just one big spectrum. Even kids, you have to figure out what's going to make a kid tick. Some kids come in and they're fine, no problem. Some kids are hesitant about the vibration. Some kids are hesitant about a taste. Some kids just don't like getting in a chair. And you have to figure out with each kid what they need to be comfortable. And sometimes you have to say, you notice they have a trombone, like you said, and you use that to get you in, or you notice they have something on their shirt they're wearing, a character, and you say, okay, this is the same toothbrush that Spider-Man uses, whatever it is. And special needs is the same thing. You just have to figure out what each patient is worried about, or what they're sensitive to, or what they're going to react to, and you just try not to do it, or try to modify what you do to avoid that. And so that's why special needs is really a big part of what we do as well. When I first started seeing special needs patients in residency, I was, understandably hesitant about it. I think a lot of people probably would be at first, but once I saw a few, I realized how much I enjoyed it, because you really can make a big difference once you learn that you can do it, and how appreciative the parents are that someone is able to help them, and give them guidance and get in there. And I just loved it. So I'm always happy to see special needs kids when I have the opportunity. Um, and what I really try to do is just figure out with the parents' help. Parents are your biggest asset as a pediatric dentist, and I'm sure in other therapies as well, because they really understand their kids and what they're hesitant about, what they like, what they don't like. And I spend time talking with the parents, understanding what their challenges are, and then I can use that to help get the appointment done. And sometimes it's, you start very slow, like Dr. Gross said, and you don't do much, and then you build onto it. Sometimes if you just can figure out what to avoid, you can get a lot done because you have your game plan. But same with the home care. A lot of what we do is we try to give the parents guidance, make them feel that we're part of a team together. It's not like it shouldn't be a stressful thing that they don't want to bring the kids in because they're nervous. It's going to be difficult. It's like we're in this together. We're going to help you, help your kid, and shouldn't feel worried about it. And we'll do what we can do. Whatever happens, happens. It's nothing's a big deal. You have to just be relaxed about it. And
well, along that vein, do you speak with the parents ahead of time so that they can tell you some information about their kid, what might likely turn them off, what they like? They happen to like Mickey Mouse, you'll just happen to have a Mickey Mouse figurine in your office, that kind of thing.
yeah, sometimes, it's every approach is different. Sometimes, we'll get a sense that it's important to talk to them first. Sometimes we'll bring the kid in first and see how they are and then start talking to them. Sometimes parents want to talk to us first because they know there's certain things that they want to discuss with us. So yeah, all of the above.
Well, I did not to interrupt, but Michael made me think of something is as a team approach. One of the things that pediatric dentists and pediatricians, I'm sure too, is you really treat the parents as well. I always make a joke when I see that 1.5-year-old kid that's coming into my office for the first time. I said, this is the appointment where I leave the kid alone and yell at the parents. The other thing I wanted to say, and I said this once, and I can't believe I even said it because it's so profound. I think Michael and I were together when I said it. I said that all kids are special, honestly, and special needs kids are just special in their own special way. And so we can get a kid that isn't on the spectrum, isn't neurodiverse, and they can be a terrific challenge. I mean, more so than some spectrum kids. And so honestly, it's just a box of chocolates with children sometimes. You just never know what you're going to get. And sometimes the parents are nervous about it, and the kid comes in and does beautifully, and the parents are so blown away.
I am very appreciative of the acknowledgement that no kid lives alone, right?
Right.
And the fact that you want to create a team. I'm wondering if there is some initial tips that you can offer to parents to, because these are kids who are orally defended, all right, in terms of dentistry, tend to be the kiddos who also are very picky eaters and can't tolerate certain tastes and colors and textures and so forth. And these are, like I call them my, M&M kids, milk and macaroni, type.
Right.
So their diets are poor. It reflects in terms of, the reflection of the condition of teeth in terms of what they will tolerate. They may not tolerate hard foods. They may only want to chew hard foods, and so forth. What would you guide parents, kind of as a primer, to say, let me give some strategies that you can start doing to exercise at home. Yes, start early, but doing what?
Let me take that. I think one of the things that help is if the parents have an understanding of, elementary karyology, what causes decay, what foods to avoid, the concept of frequency and duration of the carbohydrates on the teeth versus the food itself. And I think that really helps too. You talk to them about avoiding certain kinds of foods, sticky, chewy foods, raisins, things like that. So you kind of, as long as the parents have an understanding of certain things to avoid. You give them strategies. And one of the things I like to say is, as hard as it is to brush your child's teeth, and as hesitant as you may be to force them to do it, it's harder to fill cavities. So I think it's important that from an early on, you really get in there and do some oral hygiene. And I am empathetic. I do understand that it's difficult, because it's difficult in any 1-year-old, truthfully.
Sure.
But I think it helps.
Oh, excuse
Sorry.
me. I was going to ask if either of you give talks to the public. Do you go to synagogues or churches or public spaces where parents can come and listen to you say that? Because most parents of any child will never think of bringing their 1-year-old to a dentist.
Right.
Just to acclimate them to what that looks like. Going in a waiting room, seeing toys, they may know it. They're 1. They don't know much about the outside world. So
we don't really get out much to speak in the community that way. But the guidelines from the American Academy of Pediatric Dentistry and pediatricians have been for a number of years now to recommend the first visit by first birthday. That's what they recommend. And many pediatricians are telling their patients to try to come in that age range. So the word is out in that respect. And we just feel that it's so important to get them in early if we can, just to give them the education and set them off on a good routine, because so many of the issues that kids can get with their teeth are so preventable if you start with a good routine. So we love to see them that age if the pediatricians will send the word out. And even to the extent that if someone doesn't have insurance or whatever, we'll see them for no charge under 18 months, just to be able to get them in and get that information out to them. Whatever happens afterwards happens afterwards.
This reminds me, it was only a few years back that airlines began to understand children's phobias, and begin to introduce the concept that you could, with permission, go through the TSA line to experience what that is, to actually go through into the cockpit, to go sit in the seat and put on a seatbelt and everything other than the plane taking off. I like this concept of giving a primer to families to say, come into the dentist's office, whether we actually even get a chance to examine the baby's teeth or not. Just let's take a look at what goes on inside a dentist's office. Yeah. Let's take a look at, the prizes. Let's go see what the chair looks like. Let's go hear the sounds and so forth, and the lights. And as you said, get accustomed to these kinds of new sensory experiences until it becomes, in some fashion, normalized.
Right, especially with the special needs kids. If they come in, look at the office and pick a toy and go, that's great. They're happy. They get a toy. And the next time they may sit in the chair and get a toy. So, yeah.
I want to add a point, just that, I think from what I've heard over the years from parents, a lot of them, after they came in and the appointment went well, they expressed like, oh my gosh, I was like so worried about this and I didn't want to come and I've been pushing it off. And I'm so glad I came. And I just, if I could get a message out to any parents maybe watching who are thinking these thoughts, come in. Don't be worried about coming in. We're not gonna, make it difficult for you. Whatever your kid is ready to do, that's what the pediatric dentist is going to do. But you'll be able to get your kid started with the getting comfortable. And more importantly, it gives us an opportunity to work with you to figure out what can we recommend to do at home? What's really important? What is in your kid's case going to be the best thing to focus on to help them have as healthy teeth as possible? And it's going to be different for different kids. But if we never get a chance to talk with you, we can't help you. But we can do a lot by bringing the kid in, whether we clean their teeth or not, whether we check their teeth or not, whether we take x-rays or not, whatever far we get, there's going to be a benefit. And people should realize that it's not just about getting every single thing done that we typically would want to do in an appointment, but whatever we can get done is going to be building on the comfort for the kid and giving really important guidance that can be very helpful.
I'm also thinking almost in reverse. If you get a child who is now comfortable with going to the dentist, I'm wondering if that might expand other areas of comfort, whether it's food choices or tolerance for different sensory experiences.
Sure.
And so you have actually greater flexibility because they went to the dentist, as a positive. I am very, very pleased that you've come on and to spread the message. We only have a couple more moments left, but I'm wondering, is there anything in particular in addition that you want to add to, because we're obviously talking to families now, we're talking to parents.
Sure.
We've encouraged different strategies, meet the kids where they're at, start early. Any kind of words of wisdom that they can take away with, because I think a lot of parents, when especially if the child that they're experiencing is one of their first, and so they don't have the previous experience of knowing how to normalize a child's behavior. How do you guide? What would be some of the thoughts to assist in choosing both the right dentist and just the right experience to make this a positive overall achievable goal?
One of the things we find is that adult dental phobes would traumatize as children in the dentist's office. And something Dr. Hess said about her experiences, I think it's important to let the parents know not to let their anxieties and their hesitations get in the way of providing a comfortable, caring, positive experience for their kids, because a lot of parents come in with their own baggage and it does get transferred over to their kid. Sure. In a way. Yeah. So I think, and I do understand that's a difficult thing, because a lot of the time I'll see the father sitting there white knuckling it a little bit, and the kid's doing great, So that's one thing.
Okay. And that's a good point, because whichever parent is the better parent to bring their child is the one that should do it. Right. It's not the mother's job or the father's job; it's a parent job.
No. Perhaps not the white knuckler's job.
Yeah, not the white knuckler.
Yeah. Well, it's really been a pleasure for both of you coming on and sharing this wisdom and normalizing, I think, both the pediatric and adult special needs dental experience together. I want to tell you that you have given a lot of the families that I know that we see hope, which I think is a great gift and direction. And we can't thank you enough.
No, it's our pleasure.
Thanks
for listening.
Because you're our first dentist, and it's a unique experience, I think, for everyone listening and everyone who will find out about this episode, because there's always, in my experience, a parent who's been nervous about going to a dentist and a child who has picked that up, as you said. This is wonderful information, and the kindness coming from both of you is such a wonderful selling point to dentistry.
So this is Dr. Esti Hess.
And I'm Dr. Ann Kirsch.
And this has been a wonderful episode of On and Off the Spectrum podcast. If you liked what you hear, please go ahead and subscribe, follow us, and tell your friends. If there is something that you feel you can add by becoming a guest on our show, please reach out. At the same time, we want to thank both Drs. Gross and Kleinman for adding their dental wisdom, their kindness, and just their overall sensitivity to this very sensitive subject to help us move forward. And we, again, expressed our thanks.
Yes. Thank you both so much.
Our pleasure.
Okay. Take care.
Bye-bye.
Bye-bye.
Bye.